Welcome to The Explainer. Today, we are tackling something absolutely massive. We're looking at a complete paradigm shift in how we understand and approach type 2 diabetes. We're going to break down exactly how you can actually reverse it completely using nothing but your diet. Seriously, it's a game changer. Let's decode the science of taking your health back. Okay, let's dive into this. Back in 2019, the American Diabetes Association gathered their top scientists to produce a major consensus report on nutrition. And you know what their conclusion was? They stated flat out that reducing overall carbohydrate intake has the most evidence for controlling type 2 diabetes. That means the top scientific consensus right now supports a low carbohydrate diet as the absolute most effective tool we have for managing and even reversing this condition. It's a huge, incredibly validating nod to the power of what we choose to put on our plates every single day. And guys, this represents a totally massive shift in medicine because for years, major health organizations basically labeled type 2 diabetes a chronic progressive disorder. I mean, that sounds like a permanent life sentence, right? Like you're just stuck managing a slow decline. But the empowering new reality, which is now widely understood by experts, is that it's actually a reversible dietary disease. When patients lose weight and shift their eating habits, type 2 diabetes almost always gets significantly better or just goes away entirely. You literally hold the power here. Now, we tend to overcomplicate diabetes, but the biology at its core is incredibly simple. It is simply an overflow problem. Really, there's just way too much sugar in the body. And this comes in two main forms. You've got glucose, which your body breaks down from starchy foods, and fructose, which you find in simple table sugars and fruits. So when your body is completely packed to the brim with glucose and fructose, and it has absolutely nowhere left to store it, well, that sugar has to go somewhere, so it spills out into the blood. And when your blood sugar rises to a certain point, bam, that is exactly when a doctor makes the diagnosis of type 2 diabetes. To really picture this overflow problem, think about a rain barrel outside your house during a massive thunderstorm. If you just keep pouring water into it, eventually it gets totally full, right? And what happens next? The water starts spilling over the sides and flooding your entire yard. Well, your body acts the exact same way with sugar. Once your internal storage is full, all that extra sugar just spills over into your bloodstream. So when you're faced with an overflowing system like that, what's the most rational strategy? I mean, strategy one would be to go grab a bunch of mops and start furiously cleaning up the wet floor. And honestly, in our current medical system, those mops are usually the medications prescribed to just manage blood sugar. But then there's strategy two, which is infinitely simpler. Just turn off the tap. Stop the water, or, in this case, the sugar, from entering the system in the first place. This is exactly what a low-carbohydrate diet does. It just turns off the tap, making it a highly logical, direct way to fix the root cause of the whole mess. And we actually have incredible real-world clinical data proving that turning off the tap absolutely works. Enter Dr. David and Jen Unwin. They are clinical innovators running a medical practice over in the UK, and they were looking at the devastating rise of diabetes in their own community. They decided to try something completely different. Instead of just handing out more and more mops, meaning more medications, they started offering their patients a low-carbohydrate diet as a primary treatment alternative. Let's move to and see how this builds historically. The Unwins had noted a really alarming trend in their practice. From 1987 to 2018, they witnessed an 8-fold increase in type 2 diabetes, an 8-fold jump. So in 2013, they proactively started offering this low-carb diet advice. Now, obviously not everyone was ready to make a big lifestyle change, but about 27% of their patients took the advice and fully committed to the diet. The clinic monitored them closely over the years, recently crunched the numbers, and published some incredibly clear data. So, what happened? Well, here is the first major statistic from the patients who followed the low-carb advice. On average, they lost 8.3 kilograms. That is more than 18 pounds of weight lost per person. And they did that just by changing what they were eating. But honestly, as amazing as that weight loss is, it isn't even the most exciting part of this study. 46%, nearly half, 46% of all the patients with full-blown type 2 diabetes who stuck to the diet reversed their disease completely. Literally, completely reversed it. They were able to slash their medication use, and their blood sugar levels dropped so much that they were no longer even considered diabetic by standard medical guidelines. How incredible is that? But wait, because here is the ultimate punchline. For the patients who caught the problem just a little bit earlier, the ones diagnosed with prediabetes, a staggering 93% of them fully reversed their condition. 93%. They became completely non-diabetic again. Just by turning off that sugar tap, almost every single pre-diabetic patient in the group stopped the disease dead in its tracks and restored their health to baseline. So you're probably wondering, how did they actually pull this off? Did they all have to hire private chefs or buy super complicated, expensive meal plans? Nope, not at all. The Unwin Clinic empowered these patients with a brilliantly simple one-page diet sheet. Just one page. It had a visual infographic breaking down sugar equivalents, along with some very basic, everyday rules. It completely proves that you don't need wild complexity to reverse this condition. You just need consistency with the right foods. Let's break down those straightforward guidelines, starting with the do's. When you're thinking about what to eat, you want to focus heavily on green, non-starchy vegetables. You can eat plenty of those. You'll also want to load up on healthy proteins. Think meat, eggs, and oily fish. For breakfast, a great option is full-fat yogurt. And please, do not fear natural, unprocessed fats. Things like olive oil, butter, and coconut oil are fantastic. If you've got a sweet tooth and want some fruit, just stick to berries in moderation, since they're way lower in sugar. Eating these veggies, proteins, and healthy fats is going to leave you feeling properly full and totally satisfied, without dumping a massive load of glucose into your system. Now for the don'ts. To stop that overflow, there are a few very specific things you need to avoid. First off, cut out sugar completely. Just get rid of it. Second, you really need to reduce starchy carbohydrates. So that's your bread, your rice, your potatoes, because those break down directly into glucose once you eat them. Third, and this is a big one, watch out for supposedly healthy, low-fat foods. When food companies rip the natural fat out of a product, they almost always replace it with massive amounts of hidden sugars just to make it taste decent. Next, try to avoid snacking so you aren't mindlessly overeating. And finally, ditch the artificial sweeteners. They essentially trick your brain into thinking you're starving, which makes losing weight so much harder. So the crucial point is really a practical shift when you're preparing your dinner plate. You are fundamentally just swapping out the white stuff for the green stuff. It's really that simple. You're trading out those white starches, the breads, and those highly processed low-fat foods, and replacing them with generous portions of green vegetables, healthy proteins, and natural fats. You still get to sit down to a really nice, delicious, satisfying meal, but you are completely changing the chemical instructions you're sending to your body. Which brings us right back to our final question. Are you ready to turn off the tap? Because as we've seen, by just dropping those carbs and eating whole natural foods, emptying out that rain barrel and gaining control over your health is entirely possible. Always consult your doctor before making big changes, of course, but you absolutely have the power to stop the overflow. And honestly, it leaves us with a much deeper question to ponder. If a dietary shift this simple can completely reverse a disease that we once thought was a permanent life sentence, what other chronic conditions are we currently treating with endless mops when we should really just be turning off the tap?